I was
Good afternoon, ladies and gentlemen who have joined us via the multiple social media platforms, Facebook, YouTube, Twitter, and the Dr. Fundi channel. Welcome to our interesting conversation in Prospect as we discuss something very close to many of us, namely sports, and how that has been affected by the COVID-19 pandemic. We know that South Africa is a sports-mad nation, whether we're talking soccer, we're talking rugby, cricket, marathons, cycling, netball, we just met when it comes to sports. Some of us are active participants in sports, either at a competitive level or as part of the lifestyle. And some of us, we are just couch potatoes who follow sports through sports events through TV or radio. Now, the disruptive effect of COVID-19 pandemic with the cancellation of all sporting activities and events has had, an impact for sure to society, to sporting bodies, to the athletes themselves. Today, our topic, therefore, is to discuss that disruption as caused by the COVID-19 pandemic. To help us with the discussion of this important topic is my longtime friend and medical colleague of over 30 years. That reveals our age. Dr. Silo Clarence Mutaung. All right, a little bit about Dr. Mutaung. He's a qualified medical doctor who started by doing BSc in computer sciences at the University of Fort Hare. From there, he went to UKZN, where we were in the same class, and in 1989, he qualified as a medical doctor. He was part of that famous class of 89 that has produced a lot of academics, scientific researchers, policymakers, leaders, managers in government, entrepreneurs, and business professionals. You know, if I just have to count some of the people who come from our class, the late Professor Bongani Mayosi, who was the Dean of Medical School at UCT, Professor Ngoza Dlova, who's the current Dean of the Medical School, a leading dermatologist, Professor Boy Miataza, an ENT specialist who's at Walter Sisulu University, and we've exported a lot of academics and researchers to countries like the UK and Australia from that class. Even on the business side, we've got top guys, you know, Dr. Vikash Salih, who's now in Florida, USA, in the big pharma. We've got Dr. Marvin Maestri, who's also an investment banker, entrepreneur in cryptocurrencies and blockchain. And we've got Dr. Mutaung, who is one of the leading sports physicians in this country. He actually obtained his master's and MPhil degree in sports medicine under the world-renowned Prof. Tim Noakes at UCT. And yeah, so he's been a team doctor for many national teams. He's been a team doctor for Bafana Bafana. He's been a team doctor for the Olympic teams. He's been a team doctor for the, I think, under-20 soccer teams. And his beloved Orlando Pirates, you know, Batuma 5 skipper. All right, Dr. Mutaung, welcome to the Dr. Fundi channel.
Thank you, Mabi. Yeah, thank you for those kind words. Some of them a little bit over-exaggerated, but I'll accept. Thank you very much for the opportunity. Yes, I'm looking forward to just this general chat that we're going to have, you know, on sports. And I'm sure that, you know, it's a subject, obviously, as you said, quite close to the hearts of many, many, many people. Yes. And especially at this difficult time of, you know, this COVID-19 pandemic and the lockdown and so on. Yeah.
Yeah. Now, maybe to kickstart our discussion, your love for sports, where did it come from? I know at varsity you used to play softball, but you were not one of the great, you know, sports people.
Yeah, well, you're quite right. I mean, it's just really love for sport, but not so much excelling in participating in the sport itself. Yeah. I think just generally, I have been somebody that has loved, you know, sport just at a personal level, just being physically active on a regular sort of basis. I suppose, you know, walking the talk, as it were. You know, if I tell people about the benefits of exercise, and I don't do exercise myself on a regular basis, then, you know, that wouldn't be right, you know, ethically. So yes, I tried, I must say, playing football in my young days. I wasn't very successful. I was given names that, you know, I'm not going to share currently, and that led me to leave the sport of football. And then, yes, there was a time when I learned how to play softball and tennis, and tennis took over, and I became quite active in tennis, actually, to a point where you probably might recall that when I got to Natal, I went up to participate quite regularly in tennis, and at some point being the captain of the tennis team. yeah, the less said about the quality of the team, the better. I was nevertheless the captain of the team.
Yeah.
And then, of course, whilst playing sport, it was just about keeping oneself regularly fit by jogging along. I remember, quite in our early days, the one friend of ours that we used to quite do this on a regular basis was Jabulani Ngosi. We would go out, on regular jogs and so on, and that carried on for many, many years, even after, having qualified, us participating in a whole lot of road races and so on. Of course, he went on to do the ultra marathons like Comrades Marathon and so on. And I switched over to cycling, which is my current love, just outside, when I want to just take it easy and play golf. So that's me and sports and regular physical activity.
But then you went and studied, a master's degree in sports. That means this love was deeper than just, participation.
Well, and funny enough, this was as I described myself as somebody who was, wanting to be regularly active. Soon after qualifying as a doctor, I joined a gym, a private gym. And because people knew that I was a medical doctor, they came with all sorts of questions to me about, listen, this type of exercise and this. And little did people know about, how our medical training was at the time, that, there wasn't a great emphasis on, sports medicine, as it were. So that prompted me to, register and do some courses on gym instructorship, personal trainer, that type of thing. That went on for me to wanting to know a little more. Enrolled at UCT for my sports medicine, and that's where I met the greats of Tim Noakes and a whole lot of others. And of course, with all of that, it came opportunities that, came my way, got involved in a whole lot of sporting activities, sporting organizations, got involved with the Olympics, the Paralympics, football, and as you quite rightly said, got involved firstly at Orlando Pirates before I went on to look after a few of the national teams at SAFA.
But wherever you are, whichever team that you get involved in, they, for some reason the performance doesn't go very well.
I'm not so sure what you mean by not very well, but yeah, you could argue perhaps that in my tenure at when I looked after Bafana from in that 7-year period, you probably could say that yes, there's not much to show in terms of the trophies that came our way. But yeah, I suppose that was a bit of a rough patch at the time.
Yeah. All right. Now we are in year 2020. We are almost in the middle of this year 2020. And at the beginning, everybody was excited about this year, saying this is year 2020. Lots of promise on all fronts, and being the Olympic year, for sports people, this was like what they have been preparing for the last many years. And then February, March, the COVID pandemic happened. All right, obviously started 3 months earlier in China, but it was spreading then throughout the world. And a lot of these sporting events had to be canceled. Now, just from you looking at sports broadly, how disruptive has this pandemic been in the world of sports?
Yeah, well, I mean, this has been quite disruptive, and some very, very difficult decisions had to be made. And I mean, you will recall that it took quite a while, if I could just pick on the IOC, for instance, to get to make that decision that, look, we have to postpone the Olympics. It wasn't an easy decision to make at all. So I mean, as you know, Olympics, is held every 4 years. Now, this disrupts the whole cycle. I mean, for it to now be postponed to next year, further decisions are now have to be taken to say, all right, what do we do now if the Olympics that were supposed to be in 2020 are in 2021? Do we hold the next Olympics in 3 years' time from 20? In other words, do we go back to the original schedule? And how does that interact with other major competitions like FIFA, for instance, where there was a 2-year period between the Olympics and FIFA and other world championships and so on. So this has had a major disruption on not just the scheduling, but if you can look at the economic impact. I mean, just a country that would host an event of that magnitude, I mean, has huge benefits, economically, tourism, and so on. So for it to just, and again, a country that is hosting a major event like the Olympics, goes through preparation, and there's a lot of investment that is made into ensuring that, the event goes out smoothly. For it to then suddenly be cut like that, it's a loss, So at macro level, it obviously meant that difficult decisions had to be taken. Even back here at home, I mean, you'd recall that it also took quite a bit of time. Fortunately, not as long, for a decision to be made to suspend all football league games. And you also recall that this was at the time when things were really hotting up. There were some teams that were really looking at, holding the trophy in their hands, and that had to suddenly stop. And you can imagine the impact that this has on the players, psychologically and mentally. I mean, that's that.
Are we talking Kaizer Chiefs here?
Well, I'll leave it to people who follow football quite closely.
And Liverpool.
I had heard that, Sundowns was also in the picture and so on. And and Paris wasn't very far away either.
Yeah.
So yes, I mean, this really has had a major impact, not only at a macro level, countries, organizations, sports federations, and so on, but even down to the level of the player. Not only the player, by the way, but the followers as well. I mean, you and I, the Kaizer Chiefs supporters, for instance, who were hoping that this is the year. Liverpool supporters who were hoping that this is the year.
After 30 years.
Correct. Well, so yeah, I mean, the impact is massive.
Now, you touched on the issue of the economic impact. I mean, most of these, elite, competitions like, the Olympics or even the Premier League, soccer, Bundesliga in Germany. I mean, all of those are funded through, TV rights. So that is linked to matches played. And obviously, no matches, then it means no money. Correct. And they have to pay players a lot of money. And if that money is not coming in, I'm sure it's a problem. We've heard some of the countries talking about reducing salaries of players, as a way of trying to ensure survival of the teams. So you're right, the economic impact has been hectic. Now, if we look at the athletes themselves, who have been preparing for Olympics, mentally and physically, with their eyes on participation in June, July of 2020, all of a sudden, they are told that this thing will only happen next year. What do you think a player goes through? Because obviously there's supposed to be some phases of training and getting prepared for that competition. As somebody who obviously has helped a number of teams
to prepare, for such things, individual players and teams. What do you think has been the disruption in terms of those postponements or cancellations?
Yeah. So perhaps let's start where you started off. Let's look at the mental and psychological impact that this will have. If we use the example of football, for instance, that stoppage happened at the time that it was critical. It was almost the last phase of the race. People were eyeing the trophy and so on, and so just for all of that to be suddenly cut, that clearly had a major impact. For an international athlete, training for the Olympics, you go through different phases of training, and you are at your peak at the time that there's competitions that you participate in leading up to the Olympics. So everything is worked out well. For that to suddenly be cut short, and now you're looking at a postponement, and if you recall, it wasn't very clear even whether or not it would be postponed for a few months, or a year, or called off completely. So that obviously has a huge impact on the mental psyche of the athlete, himself or herself. Then of course the physical aspect. All right, you are at the peak of your fitness, and suddenly you then go through, as a result of the lockdown, through a period of inactivity. You're very limited in terms of what you can do. Of course, depending on the type of sport that you do. If you look at perhaps cycling, you could argue that perhaps the impact isn't that major for especially the top level cyclists who can do some bit of indoor training in their homes that can quite mimic cycling outdoors. But for team sports like football, you're very limited in what you can do. You could perhaps train on your own depending on the level of motivation, and to try and maintain certain aspects of your fitness, like core strength and so on. But certainly some aspects of your fitness, your tactical skills will be impacted. So again it goes back, because these things are intertwined. The mental aspect then of saying, okay, so when is the normal going to resume? The normal being, and what would be the new normal? And how is that going to be? We'll talk a little bit later about how then we restart a normal training program after a period. So what I'm saying, the impact that it has had on the individual athlete is both mental, psychological, and physical as well, in terms of the level of fitness.
Yeah. Now we'll get back to the issue of athletes. I'm just broadening this discussion. I said at the beginning that some people who are not necessarily active sports people, but people who actually use, following these sports on TV and other channels as part of escapism from their daily realities. Now, we've been locked down with very little to do. That form of escapism, which is watching sport, which is something that we know even before the New South Africa. A lot of our people, they actually, forgot about some of their daily realities. He was there to follow, Chiefs, Pirates, Swallows, and Springboks and things like those. So what do you think has been the impact to us now who follow sports as our weekend fix, which was now taken away from us suddenly?
Yeah, I mean, The impact has been huge. This is why you've seen the advent, just apart from anything else, the whole idea that you're now imprisoned in your own home, and you've got to find something to do within your own home. That in itself, obviously affects your mental, wellness. Now, if you've been that sort of person that you have a routine to say, I've been following my team every Wednesday and week, come weekend, we know that we have this match to watch and that match to watch, this critical game to play, and we're going to win this. I'm making sure that I'm getting a whole lot of my friends around to come and watch this game. Clearly, all of that suddenly stops, and it's a huge negative impact on our mental well-being. If you flip through channels on television, fortunately, there has been some of the old stuff that has been repeated, and you could through social media as well. You could catch some of the older good moments in sport that have been there before, that perhaps could refresh your memory and keep yourself somewhat sane, as it were. But the impact, no doubt, has been there.
Now, on another angle, South Africa and maybe the world, we've been seeing an explosion of what we refer to as lifestyle, diseases, hypertension, cholesterol, diabetes mellitus, obesity, and as medical people would advise people to manage their diet, but also regular exercise. Now, come COVID pandemic, and people who were actually taking that advice from their treating doctors, they can't now get involved in that regular physical activity. And we also know from reports that some of the people who are on chronic meds, they could not get their meds, because of fears of getting infected on the way to hospital, or the hospitals are not fully functional. So I just want to hear from you, from a health prevention point of view. Do you think the fact that people could not get involved in regular exercise could reverse some of the gains in terms of managing their own health conditions?
Absolutely. I mean, the lockdown has had, that sort of impact as well, that clearly it has limited the ability for people to be involved in regular physical activity. I must point out that not to the same extent. There has been people who've been able, depending on what they can afford, who've been able to continue regular physical activity. I made an example earlier about indoor cycling. Somebody that is involved in cycling and has an indoor bike, like a watt bike, in his home or her home, such a person is not disadvantaged. But somebody who relies on going out or going to some place to go and join others to do exercise, suddenly life changes for that person. I must say, though, that there has been a lot of advice going around in social media. People have, lots of organizations, including gyms that had to close, by the way, have been coming up with a whole lot of advice in terms of what is it that people can do in their own homes to keep up, at least do some sort of regular physical activity. Lots of home exercises that people could do that uses body weight and not, these sophisticated, gym equipment. And a lot of people have been readily showing that on their social media to share with people, different ideas. The major difficulty has been, I'm saying major difficulty because this has affected quite a lot of people, the frequent, trips to the free refrigerator to see what's in there, to, people tend to load up. Again, it may be through frustration and, of the lockdown, the fact that, people have nothing to do. So the rate at which, they eat also goes up relative to, how much activity they can do. And that, of course, has had an impact on their state of obesity, if we can call it that. I mean, we've had this major problem of obesity that is associated with a whole lot of lifestyle diseases. You've mentioned a very important aspect of, the impact on those people that already have chronic ailments. We've seen that whereas, people have not been able to visit their doctors through anxiety, of course, of saying, if I go to my doctor, is it possible that I may meet up some people that, may transmit the virus to me, and so on. So that has had some sort of impact on, treatment of major chronic ailments like diabetes, hypertension, and so on. But I must say, I mean, the government has tried to try and mitigate that risk, and just because at least pharmacists, some people were making regular trips to the pharmacists. They relaxed the rules a little bit to allow pharmacists to increase the duration of the scripts by 6 months for those chronic ailments, so that at least, treatment for people with chronic ailments is not disrupted. Courier services that have been delivering chronic medication to those that are on medical aids have continued. I think the one worrying aspect is, monitoring of the chronic ailments. As you know, some chronic ailments like diabetes, people need to do tests such as HbA1c to see what their control is like. That unfortunately has taken a dip because people have not been able to visit their doctors to get these tests done. We're hoping that this is something that will be reversed with time. And yeah, it's obviously something that's concerning.
Now, Doc, there is what we call the Comrades Marathon in South Africa, which is one of the top races, long distance races in the whole world. And they were, the organization that runs this were amongst the last organizations to be decisive on whether this thing is going ahead or not. But eventually, they've just, canceled it. Instead of that, there will be like a virtual comrades, thingy. Now, organizations that run races like Two Oceans Marathon, they were quick to take the decision. Now, anyway, so when we look at sports, do you think the risk of transmission of COVID-19 is the same? We hear about contact sports and non-contact sports. Can you just talk to us around that? The risk of transmission of COVID-19 between players or between players and the officials, depending on the type of sport.
Yeah. So I think that a few important points to make is that the spread of the virus remains the same, whether, it's amongst people that play sport or among people that don't play sports. It is via respiratory droplets through mainly coughing and sneezing. People have asked questions around whether or not, the virus can be transmitted via sweat. That has not been proven yet. So some sports are at slightly higher risk for transmission as compared to others. Contact sports, like you mentioned, simply because people then are within the 2 meter or 1 meter distance, such that, it is easier for somebody to then, get the respiratory droplets from one to the other and thereby transmitting the virus. So the risk is still there in contact sports, a lot higher as compared to non-contact sports. In terms of modes of transmission, like I said, it's just through respiratory droplets and not any other way that people, have said. I think the basic important things again is the hands. all right? So especially in contact sports, if somebody sneezes, even if the person sneezes into the elbow and you go touch that elbow and you touch your face, that's how you're going to transmit the virus. So yes, that essentially is the risk. And sports people are not necessarily at higher risk as compared to everybody else. What makes the risk is the distance between two individuals, one having the virus and transmitting the virus, and the one not obviously having the virus, who's then going to get the virus.
Now, those of us who normally watch sports on TV, sometimes you see players spitting and doing all of kind of things there. Do you think when these soccer players spit or drink water and spit that into the soccer field, is there a risk of the other one getting infected through that?
Well, yes. I mean, if the spitting somehow lands onto your own body and you touch that, you get part of that spit onto your face, into your nostrils or your mouth, and there is a chance that you can, transmit the virus. So yes, spitting is not something that, especially at this time, it's something that is completely discouraged. Because clearly, you can spit into somebody, or you can spit into close proximity to somebody who can then somehow get that spit onto his body fluids.
All right. Now, we are almost 2 to 3 months from, the lockdown, let's say 2 months. Yeah. And a number of sports bodies now are starting discussions around getting back to, sporting activities, the competitions. We've seen the German Bundesliga. They've had their second round of matches already. They're on week 2. In South Korea, we've seen them. They've gone back. Italy is close to doing that, and Spain. And in England, they are also close to doing that. Now, if you were asked by those bodies to just advise them on what precautions need to be taken. And let's keep this one maybe with just soccer. If you were you were asked to advise them, what kind of advice would you be giving? By the way, we still have the PSL here that has not yet decided. So if you were asked by the PSL to give advice on what would be minimal risk when they reopen the competitions, what would you say?
Yeah, that's another difficult one. It's not easy. So let's just say for the PSL, the issue is, okay, normally the season ends around this time and the new season, and starts again within a month or two. Is it possible to maintain the same sort of timelines? And the answer is clearly not an easy one, but perhaps one could even say no. So then it is about the risk of transmission amongst the players. And then, of course, it is, the spectators. So for the spectators, it's a slightly easier one, because when you start, clearly the first thing that needs to be open is for the players to be able to start regular training. Now, even there, and regular training of obviously behind closed doors, no spectators for the next few months, either at training sessions or at matches when they start resuming, because that's going to take time, right? So starting just with training, that also would be a bit of a difficulty. Number one, it's got to be phased in over time. Like I said, if at this point, players would have lost some element of their fitness, and to get to the level where they were before this whole thing, stopped, it's going to take some time. It's not a simple thing of switching on and off. Just to give an example, if you've lost 2 weeks of training, you're probably going to need about 2.5 weeks to get to the same level of fitness, before obviously, the stoppage. So it's going to take a little bit of time to get players just building on fitness. We'll leave that to the trainers, but just to manage the risk of transmission, it's advised that, players, for instance, you can't have them all train in one group. And in the beginning, you'd have to make sure that you maintain some sort of distance. In fact, what's recommended at this point is about 6 meters. So if you can imagine, you have players spread out all around in the field, where there's at least a 6 meter distance between different players, to ensure that there's no possibility that there can be exchange of respiratory fluids between any two players. And that's just around the training. In terms of how they get there, you can't get all the players into one bus and transport them there. And off the field, they have to be wearing masks to ensure that they conform, and also that it's not about them. It's about if they are, for whatever reason, maybe carrying a virus unbeknown to them, they shouldn't be spreading it to other people. So it's still important for them to wear masks. So and the other basic things, like making sure that they wash their hands frequently. And or if they, it's not possible to have soap and water around the field, but at least hand sanitizers around the field. And even though at this point there's not much evidence that the virus would survive on the training kit, it's advisable that after every training session, the training kit is washed at least at about 60 degrees to hot water to ensure, with detergents, to ensure that there's no virus that survives that. But just to manage the training session, and perhaps to take a few steps back, even before training starts, on a daily basis. I mean, the sports medical practitioners there would have a lot on their hands, because they would have to conduct risk assessments on the players to ensure that the players are well enough to start training, and that mentally they are supported. Remember that players also come from the community. I mean, if a player comes from a home where there's a possible person that may be carrying the virus, they're not certain, or that a family member is in hospital, suffering from COVID-19, that sort of player would need mental support, just to ensure that training is supported by enough nutrition along the field, making sure that hydration principles are maintained. There's no sharing of bottles, there's no hugging, and all sorts of things that were done before. So there's gonna have to be a change of mind. There's gonna have to be lots of talking to players, lots of talking to other officials that support the players, because it's not just the players, the key people, all of those that are around the players. So it's not going to be business as usual.
So things like the goal celebrations that we normally see, where the players go and congregate and do lots of things like that. So are you saying those things are things of the past, or should be things of the past?
For as long as we still have this pandemic, unfortunately, those things are not going to be allowed, because it goes against the principle of preventing spread. Yeah.
Now, I just want to pick your brain here. You know more about soccer than I do. Now, in soccer, there's things called free kicks, and then you see players lining up shoulder to shoulder to try and prevent the ball from going through into the, to beat the goalkeeper.
Yeah.
Now, that's part of the game. So are you then saying there must be social distancing even there? Because if there is, then it's no longer a wall. Just your thoughts around that. Do you think there should be some amendments to some of the fundamental rules of soccer?
Well, that's an interesting one. I don't see, at least here at home, competitive soccer happening within the next 2 to 3 weeks. I think that we're going to start seeing opening up of training, first of all. And then when matches start playing, start to be played behind, closed doors, there may have to be some modifications. There's already talk around having 5 substitutes instead of the normal 3, ensuring that players are not allowed to spit. You may be seeing yellow cards now, red cards being flashed because of players that spit all over the place. So in terms of, the free kick walls, that's part of the normal game. I don't see that happening. But again, the reason why I was saying we're unlikely to see competitive football starting now. If that happens way down the line, perhaps during level 1, when we can start seeing a bit of games, perhaps at that point, we might be at a point where we could say, well, look, let's keep some of the rules that used to be there, or even amend. There's nothing wrong in saying this is risky, amend it, but I honestly don't see how else you can have a wall with people standing a meter apart. Then you can't call that a wall.
Well, late last week, we had, or we saw some reports that the rugby people are actually considering amending some of their rules. For example, there's something called the line-outs, where there's a close contact, of people as they are waiting to out-jump each other. And this thing called
scrum, for that matter.
The scrum, which is where they are breathing on each other's necks. My understanding is that the rugby people are seriously considering for the near future to just do away with those as part of COVID-19 fighting strategies on the field. And I'm sure if we look at each sport, there are things that could be amended. But if we're looking at individual sports, whether we're talking maybe guys who do surfing, we've seen a few people in Cape Town who have defied the rules, and they are surfing there, and their argument is that the risk of infection in that type of sport is actually minimal. So basically, are you saying each sporting code should actually look at what is risky within their sport?
Absolutely.
Yeah,
no, absolutely. No, sports cannot be looked at, the same way. As I said before, the risk is when people are close to one another within 1 meter to 2 meters. So sports like swimming, for instance, can go ahead. I don't see any problem with swimming, because swimming takes place in mostly chlorinated pools, and chlorine is effective in killing the virus. So for as long as normal hygiene practices, are maintained outside before people get into the pool, to ensure that the social distancing, that is maintained, and people wear masks, and wash their hands, and everything that we've mentioned, and into the pool, there really shouldn't be any problem. And we're talking individual pools, large pools with single lanes. We're not talking, group events within pools where it's possible that people can still be close to one another and so on. Individual sports like
things like water polo.
Correct. Yeah. So other sports like cycling, for instance, for as long as people don't cycle in groups or pelotons, and that people cycle singly, I think that shouldn't be a problem. Another one that people are talking about is golf. Golf is one sport where you can practice social distancing quite effectively. You only have a maximum of 4 people, that play any one hole. You could, for instance, have rules that in a cut, you can't have 2 people. You only have 1 person per cut, and that people, at the tee box, they don't stand within 1 meter or 2 meters of each other. And sports like those can go ahead. Tennis, singles tennis, something like that can go ahead, as long as, and I repeat, all of the other issues that we've spoken about, the washing of hands, coughing into elbows, washing the hands regularly, and social distance, if that is maintained, then that's really okay.
All right. Now, just on the issue of masks, there was an article I came across, but I didn't really follow up with it. But a situation where somebody experienced respiratory challenges, they were exercising, wearing masks. Now, is there a danger to people to be involved in vigorous exercise whilst wearing masks?
Yeah, I saw that article. I mean, it looked a little suspect. So when yes, of course, it is uncomfortable to be running, for instance, wearing a mask. But if you're wearing a cloth mask that allows a little bit of air to come through, it shouldn't really be a problem. And if you leave a little bit of a distance between your mouth and the mask, so that you can still get air coming in over or underneath the mask, that is still fine. I mean, the whole purpose of the mask is really to ensure that your droplets don't, go beyond where you are, your face, as it were. Yeah. If it just fits snugly and it's not too tight and uncomfortable, you can. I mean, I've done it. I've been cycling wearing masks or a bandana around my nostrils and face. And yes, it's uncomfortable, but you can do it.
Okay. Now, this past week, we heard that the schools are going to be reopened, with the grade 7s and the 12s being the first group, and then the others will be staggered, over a period of time. Now, the question I have then is, if you had to advise DBE, Minister Angie Motshekga, on resumption of sports in schools, do you think they should, go ahead with that as well, or it should just be resumption for academic purposes and no sports?
Yeah, that's another tricky one. I think in the beginning, you might want to leave, especially any sporting activity where the children are in a group at any one time. You might want to think carefully about how you're going to do that. If you're going to have sporting activities, I mean, it's still important. We must accept it's still important that children also become regularly active. However, do it in such a way that you don't get them all in a group at the same time. Ensure that you have some sort of social distancing. You can, for instance, let children run around a field, a sports field, one after the other, so that at least they are still able to be active, but without being too close to one another. So whatever sporting activity or exercise activity that you choose, as long as the principle is that you need to ensure that you have minimum number of children all at the same time. It's very difficult, I mean, to say this sport cannot be played, this one can be played, but we've made examples already around, for instance, swimming, what you can do as long as you ensure that, you maintain social distancing and normal hygienic practices.
Now, I made an example of the German Bundesliga as one of those examples of sporting bodies that have now decided, they must go back to competitive, sports. Yeah. But there are some players from some of these leagues, even in the UK, who are actually refusing. They are saying, we don't want to be used as guinea pigs or lab rats. Yes, we've got contracts with these teams. However, we think our health and the health of our families should come first. Do you think they've got a point?
Well, yes. I mean, that's also the the mental support, mental and psychological support that I spoke about. Because every player, would have different issues that will have to be carefully assessed, and players would need to be supported. If a player is anxious about the fact that I may actually, expose myself to the virus by participating in a game, already you have a player that's not going to give you their full, the potential when they get onto the field, because they have issues that they're worried about. So, it's best that you support that player mentally and only have players that are really committed and are able to, give their best onto the field, and they have no psychological issues. So whatever issue it is, I think it warrants proper assessment and it warrants support. It just cannot be dismissed.
Yeah, okay. Now, one of the things that have been put in place as part of the return to the fields has been the testing of players. Every time they come in for training, their temperatures are taken, symptoms, they're asked for, symptoms that could be suggestive of COVID-19. Do you think testing of players is actually the right thing to do? And I'm asking this question because I'm thinking of the fact that some people are asymptomatic and they are carrying the virus. So yeah. What are your thoughts there?
Yeah, well, maybe let's differentiate between testing and screening.
Oh yeah, screening, yes, yeah.
Yeah, it would be vital that all the players are screened on a daily basis before they report for training or whatever form it is, be it limited competition or whatever. It is vitally important to acknowledge that players also come from communities. And if there are issues that are resident in communities where they come from, we would need to, look at that on a daily basis. So firstly, risk assessment in terms of whether or not it's possible that the player might be coming from an environment where there's possible risk of transmission. Okay, not that it's going to change how you deal with, the normal practices of prevention, but at least if you have that, you can perhaps advise, in terms of isolation and what have you, The second aspect is you may be dealing with players that, remember that players generally their age, they're in that age category where they're unlikely to get severe illness. So they may be exposed to the virus, but some of them may be asymptomatic, all right? Or may be mildly symptomatic. So it is important then that during your screening, you mentioned, the issue of temperature, but all other issues, have you had a cough? Do you feel, you have difficulty in breathing and so on? And if there's a chance that somebody has been exposed to the virus and is showing signs of symptoms, we use a simple thing called the neck check rule. If the symptoms that are displayed, and it might, by the way, it might just be a normal viral infection, not necessarily COVID, that if somebody has symptoms below the level of the neck, such a person should not be allowed to train because of the risk of something called viral myocarditis, which is an inflammation of, the heart muscle, which can lead to the heart suddenly stopping and the person dying. So you don't want to, have that sort of situation in your hands. So it is vitally important that screening, that type of screening is done on a daily basis on all the players. The issue of testing for COVID-19, I don't think it's something that, should be done because, again, you need to ask yourself the question, if you're going to test all the players for COVID-19, besides the fact that it's not, in line with our current guidelines, what are you going to do with the results? You might find half the players are COVID-19 positive, which might suggest that, yeah, of course, they're all asymptomatic, but they're able to continue training as normal. What are you going to do? If none of them, if only one, so you've got to know exactly what you're going to do with the results, if you do testing, but it's not something that's advocated.
Yeah. All right. As we go towards wrapping up our conversation, I call you Tau. I found it difficult to call you Dr. Mtaung in this interview. But anyway, I'm sure there are other issues that I've not asked you about. Is there anything else that you would want to share with our viewers in relation to COVID-19 and sports, as part of the empowerment? Because parents out there are really, really jittery, especially about this going back to school situation.
Yeah, I think we've covered so much ground. But I think just to emphasize, if anything else, it may not be about stuff that we haven't discussed, but perhaps just to emphasize on those very important issues. The very important issues that we need, just generally speaking, if you get yourself involved in regular physical activity at moderate intensity on a regular basis, you are better off in terms of, your immune system being a little bit stronger, and I'll put it in those terms, to be able to withstand a whole lot of other infections or to deal better with other minor infections. So it's important, number one, to be active on a regular sort of basis. Yes, now at least, we do have on a daily basis that free time between, or at least that open time between 6 o'clock in the morning and 9 o'clock, that you can go out and do something. But if you feel that it's still too cold, there's stuff that you can do, and lots of them are available, on social media and elsewhere. The second thing is that it is still vitally important to ensure that we maintain all of these principles that we talk about every day, and you see them everywhere, that before you leave your house for whatever reason, please wear your mask, wash your hands regularly. If you do cough or sneeze into your elbow, onto tissue paper, please make sure that you throw that away and do not touch your face often until you've washed your hands thoroughly. And the only way that we can limit the spread of this virus is by maintaining social distancing and following those simple etiquette, coughing etiquette, and washing our hands, as we normally say.
Okay. Now, the last one from me. We've seen people stocking up on a lot of supplements, partly because they want to build up their immune systems, because these are, most of these products are sold as immune boosters. Yeah. We've also heard about Lingana, Mhlonyane, and so any advice on people on the use of these immune boosters, especially professional athletes, because some of these things, they've got products that may not necessarily be allowed within their sporting codes.
Okay. I'm going to be saying something that perhaps may be disappointing to some people. All right. There is absolutely no evidence that supplements will boost your immune system. No supplement will, unless, of course, there's a recorded deficiency that you have in some element or other. Under normal circumstances, there is absolutely no need to be taking any of these supplements with the idea that you're going to be boosting your immunity. Absolutely no evidence. For athletes, the only one where there might be some sort of benefit is vitamin D. Anything else, there's absolutely no evidence. Okay, so as long as you eat a healthy diet and you support your training with appropriate nutrition, that when you go out and do heavy or at least any exercise activity for more than an hour, you ensure that you take in carbohydrate at least 15 minutes before you do your activity, when you come back, within 15 minutes of finishing your exercise activity and throughout the day, have something that has a little bit of protein in it. And of course, just eat a normal balanced diet. Supplements, you're just making your urine expensive for nothing.
Okay, all right. In this new normal that we seem to be getting to, where there's going to be competitive sports without the fans, do you think, the usual concept, let's say in soccer, where we say the fans are the 12th, player on the field. In rugby, I'm sure they'll say it's the 16th player on the field. Do you think, the presence of fans in the stadium is something that actually drives players to top performance, or is overrated?
No, I don't think it's overrated. I think there's a huge difference between playing in an empty stadium and playing before your home crowd, cheering you on. That's probably why it's used as punishment, sometimes, that you'll play your next 3 games in an empty stadium, because it does have some effect on the players. Of course, yes, I know I mentioned that it's used as punishment, perhaps as a result of what your fans did. But no doubt, having a difficult game, especially, but with the support of your fans, I think adds, to the whole motivation and, at least assists you in ensuring that, in fact, you achieve victory.
Even if you are Orlando Pirates?
Any team.
Yeah,
Orlando Pirates, Kaizer Chiefs, Sundowns, any team.
Well, so thank you very much for availing yourself for this discussion. I felt that, we've covered a lot of, in the past in this channel, we covered a lot of hard topics, around science and the disease. But I felt it's about time we also start talking about things that will bring some happiness to most of us as fans and supporters of sports teams. And there's no better person to talk to than to talk to you about this subject. So I really want to talk. I really want to thank you for your time. It's been a bit funny for me to be sitting on this side interviewing you when most of the time I'm sitting and answering questions from you on your Health Talk program.
Well, I must say, in fact, I must thank you for the opportunity and perhaps congratulate you on establishing this platform. And I think it's been doing great. I've watched a few of the interviews that you've had, and all of them have been just great. Well done on this fantastic initiative, and I hope that it grows from strength to strength. And yeah, thank you very much for the opportunity.
Okay. No, thank you very much. I won't call you with the other names that we used to call you with at medical school. Thank you very much, and thank the young man for sorting you out with Zoom.
Except he's put his face there. I don't know how he did it, but anyway, and I can't get rid of that face, but I'll ask him how he did it. Anyway, thank you very much.
All right, man. Thank you to our viewers also who have joined us during the past hour. I hope that from everything that we've been talking about with Dr. Motaung, you have picked up 1 or 2 things that are new, that will empower you as we look at the issue of sports participation in the context of COVID. So we thank you very much. We will be coming back tomorrow at 18 hours with an interview with Dr. Oak Chabalala, who is the head of Indigenous Knowledge Systems under the Department of Science and Innovation. And we'll be looking there at the whole issue of Indigenous Knowledge Systems, the research, and the potential of the economies if we exploit that area. So we look forward to having you tomorrow. For now, goodbye.